Welcome to the Nutrition Hero Podcast with Dr. Brad Watts, making heroes in functional medicine and clinical nutrition. Now, here's Dr. Watts.
What's up, Nutrition Hero family? This is Dr. Brad Watts. Welcome to another episode of the Nutrition Hero Podcast. I'm glad that you're joining us here today. Remember the Nutrition Hero Podcast. This is where we're celebrating the art and the science of functional medicine, clinical nutrition on a weekly basis. It's becoming a little bit of a family, so I appreciate your participation. It means a lot because really what I'm looking at this point in my career is making sure that I can pass on a wave of electricity into the functional medicine community that gets to ripple, so to speak, for years and years down the road. What's interesting is that functional medicine has been making a little bit of an appearance on the stage in a national perspective, and that appearance on the stage is a little scary, if you know what I mean. Now, if you're a doctor of chiropractic, or maybe you're a nurse practitioner or a nutritionist, your stepping out onto the stage in a traditional sense has been interesting as well, and usually an industry only goes as far as its usefulness to the medical community, right? So an industry, something that's looked at as complementary and alternative medicine, like who gave us that title in the first place, right? Something that has been given that CAM title is usually only going to grow as far as its usefulness is perceived by the medical community. Now, what's interesting is that in the functional medicine world right now, we're not necessarily being viewed as something that's going to be useful for modern medicine. Actually, we're being viewed as a parallel track in chronic disease management and lifestyle management. So that's kind of interesting. It's like the warships are starting to face each other a little bit. And there are many, many people and many, many groups that have been trying to bridge that gap. And I think that we're doing a very good job at promoting a better relationship. And what's interesting is that the medical community, oftentimes you'll see with groups like, the Institute for Functional Medicine, they are beginning to bring functional medicine into the mainstream, and not just as a complementary and alternative medicine model, but as a first line of defense. And what's interesting to me is that the public is really the thing that's causing this, right? The public demand for better service is what's causing your job, your industry, really, I hope where your heart is, public demand is causing that to be pulled out onto the stage in a little different manner than it has been. And what's really interesting is you get journals like the New England Journal of Medicine, where every now and then they're going to do an article. They'll publish an article that is really an inventory of the public. Like, how does the public feel about our profession? How does the public feel about modern medicine? How does the public feel about their doctor and where things are headed? So the New England Journal of Medicine, I got to give them props for being able to publish information that is kind of damaging. Like, I understand it's going to help the medical community grow, but by making them better. But right now, it's kind of damaging on the surface. And the information is this gets me, all right? So this is an article published in the New England Journal of Medicine, and it says, Public Trust in Physicians, U.S. Medicine and International Perspective. And so they go through 29 different countries and all this stuff. And what's really cool, though, is that they actually were able to put a number to satisfaction. So here's something that I thought was really enlightening. When we look at the scope or the space of medicine and healthcare in general right now, and how confident people are. So here it is, and I'm just going to read a citation out of here. In 1966, nearly 3/4, 73% of Americans said they had great confidence in the leaders of the medical profession. In 2012, only 34% expressed this view. But simultaneously, the trust in physicians' integrity has remained high. More than 2/3 of the public, 69%, rate the honesty and ethical standards of physicians as a group as very high or high. Now, this is a poll that was done in 2013. If we fast forward a little bit, Another part of the article here, it says, today, public confidence in U.S. healthcare system is low, with only 23% of people expressing a great deal or quite a lot of confidence in the system. And what the New England Journal of Medicine is essentially trying to do is fix that with this statement. We believe that the medical profession and its leaders are seen as a contributing factor, which means this. Hey, if you're a doctor, let's start making inroads and making this number go up, making the public confidence in the healthcare system improve. Now, anytime, and this is just my opinion, but anytime that you're going to get bureaucratic regulation of healthcare, that's taking the doctor out of it. The doctor is really an employee for the people that are sitting in the boardroom. And that is not how being a doctor started, obviously. And I don't think that's how being a doctor is going to ultimately continue to develop in the long run. I don't think that the bureaucratic regulation of healthcare is going to go well in the long run. Now, you can cite sources, European countries, et cetera, that are having new and different experiences and experiences that you may feel are positive, and it works for them. But I'm just saying, in this culture in the United States where we have this freedom culture, for lack of a better term, where people want choices, people want to be able to be in control of their choices, even if they're making idiotic decisions, they still want to be able to have a choice to make. And I feel like that is going to be a contributing factor, or at least maybe a limiting factor, and a limiting factor in the experience that we have with our healthcare system. So, how does functional medicine fit into this? How do we bridge this gap, and how do we create new and different experiences? And I think what you're going to find is that it comes down to the trust in the doctor themselves. So, WebMD, they always do their best to put out something that counters information like this, right? So, WebMD, they posted an article here a couple of years ago. It says 85% of Americans confident in their doctor's advice. 85% of Americans. 67% of those, right, are confident that their doctor's education level is what is going to save them, so to speak. Okay? So what they're saying is that in 2002, only 64% of people were confident in their doctor's ability, and now it's up to 85%. And what's happening is that the bureaucratic regulation is changing people's perception of medicine, but yet when they have to rate their doctor, they're going to skew it toward the high side. Why? Because of the relationship that's developed. The relationship. And if the average medical doctor right now is 15 minutes or less for a visit, right? It's actually closer to 7.5 if you read some of the articles that are more from a metropolitan perspective, not like doctors out in the countryside. So with that in mind, it's really interesting to think about this. Like, where's the paradigm shift? This is totally subjective. All of this is subjective. All of it is, because they're polling a bunch of people, and who answers poll questions like this, right? Usually people that are dissatisfied, right? So this is what's happening is people are saying, yeah, the medical system sucks. My health is terrible. It's a systematic problem, but my doctor is great. They're a really great person. Okay? Like, they're a really great doctor. I can't tell you how many times in my career I've heard that. Somebody comes into my clinic with a medical problem, with a functional problem. It might be pathology. It might just be a random dysfunction. They come into the clinic and they sit down in front of you, and I'll ask them about their experience in healthcare, and it's never good. It's never good. Like, oh, this stinks, that stinks. I've had 14 surgeries on this part of my body. And what's taking place is they're like just laying it out there for you. But when you ask them about their primary physician or their specialist, whoever it might be, it's a different story. It's a different story. Oh, I have a really great doctor. Okay? So you make a note of it. Why are they a great doctor? Well, he's a buddy of mine and I really get along with him. All right? Like, what kind of criteria are we using here on scaling or measuring on a scale the satisfaction with the medical community. So what's funny is that when people are asked about relationships, because relationships are two-sided, they never want to say, "Oh, my doctor's a jerk," right? Because what does that say about you as a patient? That you're willing to go see a doctor who's a jerk all the time. So when you ask people about relationships, they're never going to like just decry the problematic experience that they're having. But when you ask them about a one-sided relationship, what's your relationship like with the medical community right now? What's your health like? That's really a one-sided question right there. What's your health like? Because as a consumer in the United States, you're not really given two choices for responsibility. You're given more than two choices. You're given 15 choices. You can go see any doctor in the country right now, basically, if you have cash, right? And with that, what's happening is people are looking at it as a one-sided conversation because there's no relationship there. Do you kind of see what I'm saying? This is a little bit of the art that goes into functional medicine here. Because when you're setting up your practice, when you're setting up your relationship with your patients and your community, you want to make sure that you're mimicking something that's accessible. You want to make sure that you're copying something that is ethically advantageous to better results for you and your patients. Now, you have the skill as a functional medicine provider. You have the skill, right? Like your patients know that you have the skill. That's assumed. They're looking for somebody that's a leader. As you know, we had an interview the other day with Dr. Crater. He talked about they're looking for a leader. It's true. When we look at this, what's happening here in healthcare in general, there's no clear and defined leader. There isn't. There isn't. So somebody might say big pharma is the leader in healthcare. Yeah, but they're also the salesman in healthcare, right? They're not the leaders of the movement right now. They can create and then fix pathologies, or create and then fix or medicate pathologies. But when we look at a leader, there's no leader in healthcare in general, and that's why the dissatisfaction is there from a consumer perspective. But immediately when you bring a leader into perspective or into the questioning, what happens? People's satisfaction rate goes up. So, like WebMD, they're asking about a doctor, not about healthcare in general, but about a doctor. 85% of Americans over 65 are confident in their doctor's advice, right? They're confident in their doctor's education. They're confident in the accuracy of their doctor's advice. And the remainder of them, right, are interested in doing their own research because they are intelligent enough that they understand that information's there. You just got to go look. So, in this instance, recognize that people are more satisfied with a relationship than they are with just a bunch of random services and no clear cut defined leadership role. That's awesome, because what's happening right now is medicine is shooting themselves in the foot with things like opioid crisis. If you've been watching the news lately, even the government's getting involved in the opioid crisis right now. In fact, there's research that they cited that said that there's 24% underreporting in deaths from overdose of opioids. That is not going to boost confidence in the medical system at all, not one iota. And so what's like the thing you got to ask there is, who's giving the opioids? The doctors, right? The doctors, the prescribing physicians. That's where they're getting them. If it's a controlled substance, then hopefully that's where they're getting them. And if the patient's satisfaction with the doctor is not declining, what does that tell you? It tells you that you could basically destroy somebody's life with an opioid, but as long as you're friendly and you look confident and you know what you're talking about, man, they're going to stay with you. That's a problem. That needs to change, and functional medicine is the wedge that's going to fit in there. Okay, functional medicine is the thing that draws the line in the sand. Functional medicine and clinical nutrition they are the topics of progress. They are the vehicle that is going to allow your patients better and different access in the future. Now, this is cool because this is where you fit in, and this is really where the art of functional medicine fits in. Because if you don't want to be lumped in with the 23% of like the 23% success rate, so to speak, or the confidence level. Like, there's not a leader in the last 25 years that has had a 23% confidence level. Okay, so keep that in mind. But when you look at the government, right? Look at the government, it's the same thing. So if you look at political polls, president's always between 40 and 60%, right? 40 to 60, 40 to 60. What about Congress? A no-name Congress. Well, we're always less satisfied with Congress than we are with the president, right? Same thing with the medical community right now. You look at your doctor, satisfaction rates go up. Look at medicine as a whole. Oh, it sucks. We don't like that. They're hurting people. The opioid crisis, right? It's just craziness. So as we now move and we transition in this episode of the Nutrition Hero podcast into the how-to, you got to keep these stats in mind, because what you look at is what you're going to walk towards, and what you walk towards is what you ultimately become. And we want to make sure that we are putting ourselves in the 85% category. You want 85% of people to be satisfied with you and to trust you. The other 23 to 25%, yeah, they're information seekers. They're going to go look. They're just using you as an encyclopedia for free because they don't know how to Google things, okay? And so in this instance, we want to make sure that when you are participating as a primary functional medicine provider, or as a nutritionist, whatever you are, a health coach, you want to make sure that your relationship is always on the up and up with your patients. Relationship. There are some skills that I learned along the way that I want to teach you today, that I want you to employ and make certain that you are using these with your patient base on a daily, weekly, monthly, yearly basis, right? So we got computer programs all over the place in clinics all over the country that they keep track of patients' birthdays for you, and they send text messages and all the stuff, and like takes the personal touch out of these things. And what I'm going to tell you to do is to get old-fashioned just for 90 days, and you're going to see the effect happen in your practice. Get old-fashioned for 90 days, all right? When's the last time you sent your patients a thank you note? When's the last time you talked to your patient on their birthday? Actually talked to them. In a functional medicine clinic, if you are charging the way that you should for your service and your intention, you have time to call somebody. You have 5 minutes in your day to give them a call and say, hey, I was just thinking about you. Happy birthday. Okay? You have time for that. But the problem is you're not willing to do it in most cases because you go, well, that's weird. Doctors don't do that. Right? Yeah, they do. Yeah, they do. Doctors that care about people go the extra mile. And it's not even a mile. They go the extra 2 steps. Okay? It's not even a mile. You can do this. So that's one of them. Make notes. So I have a sticky note in patient files. It's not part of the patient record. It's just notes for me. All right? The sticky note moves to the next page every single time if you use a paper file. Or the sticky note is something that you put on your desk. And the sticky note is just stuff for you to keep track of. And so what are you going to keep track of? What are you going to look at? Details. Details. Your patients better believe that you have the best memory on the planet, right? You don't show them the sticky note. That's for you, okay? So your brain is not just in your head, but your brain is also on that pink sticky note with a pen, okay? And so there's a skill of being organized enough in a functional medicine perspective or a functional medicine clinic. There's a skill of being organized enough that if you can do it and you can do it well and you can do it repeatedly, it's going to pull you to the top of the pile in your community so that you're not just one of a bunch. You're the FM person to go see. Okay? There's no other choice. So that's one of the things. Number 2, when you have a patient that joins care with you, what do you send them? Yes, there's an exchange. They're paying you and you're coaching them in the right direction, so you're giving them information. Right? Ultimately, we hope that their health returns. So yes, there's an exchange, and it's completely lopsided, by the way. Like your information and experience and the heart you're giving them is worth way more than you're charging, no matter what you're charging. Okay? Even if you're charging like $1,500 an hour, okay, your attention is very expensive and it's worth it. So there's an exchange that needs to happen, though, above and beyond that, because the patient, they don't understand. They don't know your story. They don't know what you put into this. They don't see it. So if you have somebody that is a new patient in your practice, what do you do for them? What do you do? Do you send them a note? Do you send them a gift card, right? Do you send them to Starbucks or whatever? Do you do it? Do you send them a gift card to the grocery store? Not the terrible one in town, but the clean one. Do you send them in that direction, like with a grocery list? Gift card, grocery list, here you go, right? Thanks for, like, we enjoy for seeing you the other day. We enjoyed seeing you. Thank you for letting us be part of your health journey, Dr. Watts. And what happens is that makes a difference for people. You're making deposits into their life that's building the equity that you have with them from a relational perspective, right? So how many times have you seen a patient going through side effects of medication? It might be neuropathy, could be brain fog, could be dizziness. Well, it's just a side effect of the medication, and they think it's like their cross to carry. So they just, I just got to do it, right? You just got to do it. I've had diarrhea for 20 years straight with this metformin, but that's just my cross to bear. And then the moment that they get a headache or the moment they don't feel right with the supplementation, this stuff is hocus pocus. We got to get rid of this, right? How many times have you seen that? One of the things I've found is that doesn't happen so much when you make deposits, you build equity with them in the relationship along the way. This is so key to building a practice. I picked this up, by the way, from the doctor you heard a couple of weeks back that had a $7.5 million clinic. This is where I picked this up. Make deposits into the relationship. And it's things that it might cost you $1 or $2 along the way, but it's totally worth it because you're building into people. And your ability to help them get well is only as good as their ability to follow through. And if they get rid of your program because you suck at relationships, pardon the French, you just want to make sure, right, that you're doing your best. That's the point. Do your best. And so these are the things you're going to ask about. You ask about their kids, their grandkids. You write it on a note. Specifics, not like, hey, how's little Timmy? You go, hey, how was the game the other day? How was the hockey game? All right, did he score? I remember that he was a winger in hockey. I'm in Minnesota, so that's what you get, right? So I heard he was a winger in hockey. How'd he do? Right? So, or I heard you're going on a fishing trip. That's right. I heard you were bass fishing. What'd you find? Did you guys catch anything? Dig in. These are the details that good functional medicine providers are not going to brush by. And I say this because a lot of times functional medicine providers are coming out from a different mentality in clinic, like they're changing from oranges to apples. You might be a chiropractor and you are transitioning from the chiropractic mentality into the doctor of chiropractic mentality. And you have been in a high volume clinic for your entire career and where you're like really great at small talk, but you gotta know what? Functional medicine's not small talk. You gotta be able to dig in with people. Remember the details. Make the note, right? Have one of your office people just take notes for you. Leave it on the front desk and you can have a notebook and be like, hey, can you write this down? Bob Johnson, X, Y, and Z. Make sure that we ask about it. Put it on the calendar. Put a note in the computer on the calendar so that I ask about it when I see his patient file next time, okay? Like, do the above and beyond like that and make sure that you're being detailed. Like, remembering their birthday, that's standard operating procedure now. That's standard. Nobody gets any extra points for remembering a birthday because a computer program does that for you, okay? So by the way, if you don't remember their birthday, that's negative points in your book because they're getting stuff from their dentist. They're getting little postcards from their primary care doctor that say, hey, happy birthday. Thanks for being our patient. Have a good one. And like that's standard. If you're not doing that, that's minus points for you. Okay. So if you're not building into them anyway, and then you don't do some of the things that are standard now, you're already negative equity and they're looking for a reason to get rid of you. And so do the extra things here. Ask about the grandkids. Write down their names. Write down their names. If you want to go above and beyond and you want to do something that kind of freaks people out sometimes, write down their grandkids' birthdays. You're going to hear about it. Oh, I have my grandchild's birthday this weekend. Oh, cool. What day is their birthday? Friday. All right. Make a note of it so next year when that time rolls around, you can say, hey, I remember it's your granddaughter's birthday coming up. Are you guys going to go do anything fun? They're going to look at you. They're going to shake their head and they're going to look at you again and be like, how Does this guy remember this stuff, right? You don't need to be creepy about the details, but I do want to make sure that you get this, because this is how you build equity with your patients. This is how you build a practice that ends up being referral-based practice instead of you chucking money at advertising, trying to get people to come into the clinic. So this is key. This is key. All right. So what else do you do to build equity in the relationship so that you can be looked at as the doctor instead of part of the system? What else do you do to build equity? Services, classes for your patients, right? You could do podcasts like this. You could do a podcast that talks about not just give them like a detoxification protocol on paper. Do a podcast that talks about the detoxification protocol so they can get some of your tone, your delivery pace. They can get some of the attitude, and they can get some of the relationship, even though it's a little one-sided in audio. Give them that in audio form, not just on paper, right? These are things that I've figured out along the way. I've learned some of these things, and they have made an epic difference in your experience with a patient, right? They're willing to go through 2 weeks, 3 weeks of Herxheimer reactions, right? Where they have like a die-off reaction or a detox reaction, depending on what you're working on. And the side effect's not pleasant, right? Might be a loose stool. They might be brain fog, might be insomnia. But they're willing to go through that with you because they already have seen how into them you are, not just how into them being your patient you are. This is what I'm talking about. Oh man, there's another one that I thought about the other day when I was thinking about this podcast and some of the things that go into you developing relationship with patients. I was at a golf course out in Hawaii. I was on vacation with some friends, and I was at a golf course. I went and bought a golf ball that was stamped with the Wailea golf course on there, right? So I had the logo, and I brought it back for somebody because I knew that he was a golfer, okay? The guy almost started crying. It was a $2 golf ball. He goes, "You thought about me on vacation?" Yeah, I did. This guy went through so many ups and downs in his health, but you want to know what? He stuck it out because he knew that I cared about him enough to think about him when I'm 3,000 miles away from home. And what's awesome is that I legitimately thought about him. It wasn't like, hey, I should do this because I want to make sure that he sticks with me. It's, hey, he would really like this. Okay? So flip that switch on in your brain, in your heart, whatever it is for you, that allows you to start thinking about people in that arena. People that are sick, one of the things that I find is that they're, like, you've heard of the love languages, right? So one of their love languages is gifts. One of their love languages is gifts because that's what they've come to expect. Why does a hospital have a gift shop in it? Right? Because that's the love language of people that are ill. That's what it is. They make a haul on gifts and balloons and the balloon on the plastic straw at the hospital gift shop because giving is the love language of people that don't feel well. You can do the same thing, but you're not going to have a balloon that says "get well soon," right? You're going to have the golf ball. It's going to be the postcard. It's going to be a picture, whatever it is, right? Send flowers to your patient. You want to, like, one of the things that I think is really cool is I'm a guy, right? So when you send flowers to another guy, like, hey, I thought about you. I know that they had a family member that passed away, and it's not to the family, it's to another guy. Sometimes it freaks them out a little bit if they're not like comfortable with themselves, but the point is that they feel it, right? It freaks them out because they actually means something to them. If you send them a plant or a flower or whatever, that's what I'm talking about is go above and beyond. And instead of spending, like, don't think of it as marketing, think of it as retention, right? Like if you're going to spend X amount of dollars every month on marketing, take $50 out of it and task your staff with figuring out how we're going to spend this $50 on giving little gifts and reminders and thank yous, making the experience at X, Y, and Z clinic, your clinic, that much more special, that much more important. This is what I'm talking about with developing this mentality of relationship. Okay. So not to beat a dead horse, but it could be a t-shirt that, I mean, people love free t-shirts. I don't know why, but people love free t-shirts. And don't let it be an advertisement for your clinic. That's like a backhanded gift. That's like, oh, here, Thank you for helping me, and I'm going to give you a $7 t-shirt. Best t-shirts, by the way, you got to write this down because you don't want to give them a crappy t-shirt. They'll never wear it. Best t-shirts are, you can buy them wholesale. It's called Next Level 60/40 blend polyester and cotton. Okay? Next Level 60/40 blend polyester and cotton. You guys, I've actually looked into this stuff. It's that important, right? So what you're going to put on the t-shirt is something that's, it doesn't say your clinic name on there. Put a word on the front, right? Like something that people are going to wear and they're going to get asked about. Because you want the story to sell you, not your logo to sell you, okay? So it's going to be a logo that says something like, or a word that says something like beloved or healthy or hashtag healthy, right? Something where people go, where'd you get that shirt? And they have to tell them then, well, I got it from my doctor. Your doctor gave you a t-shirt that says beloved on it? What in the, like, what you're doing is you're creating culture. And what's happening, they're never going to forget it. They're never, ever going to forget it. Remember, your logo doesn't sell diddly. Your logo doesn't sell crap. It's the story that is going to deliver your intention there. Okay? So get a t-shirt. If there's 1,000 people listening to this right now, there's only 4 or 5 of you that are going to do this, but you're going to do it and it's going to make a difference and you're going to go, holy crap, how come I didn't think about this before? Get a t-shirt, get a golf ball, whatever it is, and put something on there that has a story behind it that's going to make people ask the question. Okay? So whatever it is, if you got a thing in your office that's, like a healthy posture month or whatever, then put a word on there that talks about posture. Okay? So do something like that. Don't put your clinic logo on there. Anybody can do that. All right? So develop your culture around your ability to meet people and to speak into their life, to give into their life in a way that no other doctor, no other healthcare facility is going to do it. When's the last time you got something from a hospital after you spent $20,000 on a surgical procedure from them? Nothing, right? Nothing. Maybe you get a little constipated from the opioids, but that's about all you get, right? So the point is that make sure you're thinking about this. Go out of your way to figure out how you can do different service and better service to your patient base. What's really cool is that if you find a minimum wage employee that maybe has a little bit of an issue with money, where they're not really into you charging a lot of money or that type of thing, first of all, you should probably get rid of that employee. But secondly, if that employee is an integral part of your team and they're not necessarily patient facing, task them with coming up with some creative ways where we can give to people, right? If they have this mentality where they would rather work for a nonprofit, well, they're going to have ways that they can figure out how to give, right? Make them write down 100 ways that you can make a patient feel special. 100 ways. If any single one of them comes up with the t-shirt idea, you email me and I'll send you $20, right? It's not going to happen. So that's just above and beyond. That's creating culture. That is something that they're not going to get anywhere else. Okay? All right. So you, just based off of this podcast alone right now, you should have 4 or 5 ideas that you can take into practice tomorrow and task somebody in your office with developing a note card, developing a t-shirt, go buy some golf balls that have something stamped on them that have a story to go with them, okay? Whatever it is. If you're like in a golfing community, then do that. If I'm in Minnesota, what would I do? Be something with the Minnesota Wild on it because people are insane about hockey. Maybe some bass fishing, right? That's the point. Like if you get, I even saw this one once. I didn't do this myself, so I'm not going to take credit for it. But you can get your logo branded onto a fishing lure. How ridiculous is this, okay? What you're not going to put your logo on it, right? Because anybody can do that. What you're going to do is you're going to put a story on it that people have to ask about. So with that in mind, take this information, make it actionable. Like I said, 1,000 of you listening, 4 or 5 of you are actually going to do it. Make sure you're the one that does it, okay? So this is stuff that is cheap. It takes 20 minutes of your life, and it's repeatable. You can manage this situation. So these are some of the tips that go into the art of functional medicine. The art. Is it clinical? Nope, it's relational. And based off these stats I just read you, relational is what makes the difference in the beginning because you can't apply any of your clinical knowledge. None of it. Zero, zip. If you are an arrogant doctor, if you are an arrogant nutritionist, if you are an arrogant health coach, you can't apply any of it because people are not going to sit in front of arrogance for very long. All right? All right. You're listening to the Nutrition Hero Podcast. This is Dr. Brad Watts. Thank you for tuning in. We'll be back next week. See you then.